94 121 641. Hazel, Lynn Grove, Kirksey, Almo, New Concord, Faxon, Callaway, Murray. We are Lakers, we are Tigers, we are Racers. We are better together.
Hello and welcome to our next Better Together segment. And this evening we are going to sit down and talk about the pandemic. My name is Michael Robinson and I'm sitting in for Stephen Hunter. And I don't have the fancy bow tie to wear, but we'll try and fill in his shoes as best as I can. We have a panel that's here to discuss our topic with us this evening. And joining us first, Dr. Odell. Welcome.
Thank you. My name's Nick Odell. I'm the Chief Medical Officer at the Murray-Callaway County Hospital. I'm also a practicing internal medicine physician, working as the hospitalist medical director and spend the majority of my day taking care of COVID patients. So this is a topic that's near and dear to my heart.
Welcome. We're glad to have you here. And next up, we have a student. We have Caroline Koenig. Caroline?
Hello, I'm Caroline Koenig. I'm a senior at Murray High School. I'm a volleyball player, a member of the speech team, and just a person who's immersed in everyday life in school and experienced COVID, and I'm passionate about handling it and talk about it with my friends, and happy to discuss it today.
Fantastic. Thank you for joining us. And Sam, you may introduce yourself. Welcome.
I am Sam. I am a freshman at Callaway County High School. I am in the band and I'm on the speech team. And I do a lot of things at Callaway, like I'm in FBLA, Beta Club, and I also like to share my feelings about how I feel about COVID. It's a very stressful time, and yeah.
Well, we appreciate you taking the time to be here. And normally we have 4 adults that are sitting up here, and we do this evening because you are the adults in the room just like Dr. Odell and I are. And the pandemic has been directly impacting young people, so thank you for taking the time to be voices for us this evening. I've got a list of questions that have been prepared and to share with the panel so that they may discuss. And the first question is, my father used to say, you make good choices, you get good consequences. You make bad choices, you get bad consequences. We were masked, we developed a vaccine. How did we get here? Dr. Odell, I'll let you start.
Sure. So it's been a long 18 months so far, and it did start with masking because initially, well, it actually started without masking, right? I mean, there was a debate when this first came out of how it was spread. Would masking actually help? And eventually we figured out that masking was important, both cloth masking in public versus respirators and N95s and things of that nature, but every mask does make a difference. So initially all we had was masking, and then from there we progressed to social distancing and isolation for a little while, trying to sort of flatten the curve, if you will, one of my favorite terms. Mm-hmm. And the point was to get by with as little death and mortality and morbidity until a vaccine could be developed and rolled out. And then the thinking was that once you had widespread adoption of a vaccination, that life would start to return more towards normal and activities could resume, life could go back to what we thought was normal before. But to that point, unfortunately, we've not had wide-scale uptake of the vaccine, particularly locally across the southern United States. Vaccine penetration is about 50% of the population in most places, and in some places it's even less. If you look at states like Idaho, the vaccination rate's less than 20%. And if you keep up with the news, you can sort of see what's going on there right now with the crisis that they're in. So I would say that we've done a lot of things along the way in order to improve the situation and really limit the fallout from COVID-19. But once the vaccine came out and it began to not really be believed or trusted by everyone, this is where we are. And so I would say that's the shortest explanation I can give on how we got where we are.
Excellent. And your perspective, do you have anything to add?
Just to kind of go off what you said with that quote, like a lot of people get upset when we've come 18 months into this and we're still wearing masks and we're still getting vaccines and we're fighting for social distancing to protect each other. And like you said, good consequences. And those would be quarantining instead of the bad consequence, which could be getting hospitalized or dying, even in that case, which unfortunately that's happening a lot still. We just passed a record recently with deaths of COVID. And we need to look at it from a perspective that maybe sometimes we have to lose when we don't want to do something because it's a little bit better. We have to take those sacrifices in order to keep the greater good and keep people alive and fight for progress in this battle against COVID-19.
Yeah, and going off of what you said, recently we've had a church member die of COVID. I actually was doing PE at VBS. I had this guy's son. He was amazing kid, great kid. I feel terrible that he had recently gotten married, and it's really hit the local community really hard. I feel with all the quarantining. I mean, the student population is even hit hard. Recently, the whole entire basketball team was quarantined at Callaway High. So.
And you were talking, Caroline, about a record that we recently passed. Are you referring to the pandemic back in 1918-20? Yes. Okay, and that was something that was kind of a marker. Would we get to that point? Well, we are here. We began with 15 days to flatten the curve, and then we moved to once we get a vaccine and working to get to that point. Now, with the goalposts being moved time and time again, one might understand how people have become a little disgruntled with, quote, experts. Can you explain, Dr. Odell, the scientific process with a novel disease and how things might fluctuate as we've seen?
Sure. So I think the first place that it starts is with prior knowledge. And so this isn't the first coronavirus to cause problems across the globe. There was the original SARS in 2003. And then there was the MERS, which is another coronavirus. That's Middle Eastern Respiratory Syndrome that took a place in the Middle East starting in 2012. And these were both coronaviruses, and we were able to sort of learn a lot of things about coronavirus transmission, something called spike protein and how it interacts with ACE receptors in the body, and that's how it causes infections. And so a lot of the groundwork was already laid for knowledge on coronaviruses. Certainly COVID-19's been different. The SARS epidemic in 2003 only infected around 8,000 people, whereas you can see how far COVID-19 has spread across this globe. So it's a little bit different. And the amazing part of our current state of knowledge and process and scientific discovery, the virus was first sort of recognized in December in China. They published the genome of the virus in early January in Nature, and by the middle of March, you already had vaccine production being undertaken. And so the first human subject to be injected with the Moderna vaccine was actually around March 11th, which was exactly 2 months after the publishing of the genome of this virus. And so I guess that's the best explanation of that initial sort of uptake. And then some of it was to see how widely spread will this virus become? What is the transmissibility of it? Is it going to be like the SARS epidemic in 2003 where it doesn't spread outside that local area? Will it take on more of a measles or a chickenpox approach, which is very easily spread and highly contagious? And unfortunately, COVID-19 did sort of follow that path, as we've seen over the last 18 months. So that would be the initial sort of scientific approach to a novel virus is you start with what you already know, and then through observation and ongoing research, you sort of learn some new things about it, and you adjust as time goes on. We're always in a situation of progress here. And so initially, again, I'll raise my hand and say, we did not know that masks were that important at the very beginning of this. There was questions about, do homemade mask works? Do you need to put a vacuum cleaner bag over your face? We had no idea what would be the ramifications of some of these ideas that people had. But again, as the evidence started to mount and we started to understand the spread, we were able to adjust the recommendations going forward. And so, yeah, I can see how people would become a bit tired of changing recommendations, but I mean, that's just part of life, unfortunately, and it's part of dealing with this disease. And I would say, as frustrating as that is, it would be more frustrating if nothing changed, because that means you're not, making any headway at all. So that's the approach I would take. And I get it that people are tired of it. I'm tired of it too. But it's what we have to do if we want to come out the other side of this. So
at the beginning of the summer, the president had come out and said that we could throw the mask away and be done with it. And I think that for many students, they were really excited about starting the school year.
Definitely, yes.
So now, how has this change impacted you?
Well, I feel like I see people walking around school with masks that say this mask is useless, as is my governor. And I feel like they don't really listen to what other people are saying, because as when Trump said that we were not be able to have masks, and Biden said we might not have masks as well, it really got kids excited and what would be the word? They were just excited that they wouldn't have to wear masks at school. And when Governor Beshear made the call that we would have to wear masks, it really got people's hopes and expectations very low, and they started to go through a cycle of hatred towards things and people.
Understood. Caroline?
Coming into my last year of high school, all of my classmates, we were hoping for maybe just one more shot at normalcy, one more year, because this struck in the middle of my sophomore year. So I only had one full year of high school that was completely normal.
Wow.
And it's sad to see that this controversy of masks has truly divided my class. You walk down the hallways and you'll get glares from people depending on what side of the argument you're on, and it's just saddening, because as science is progressing, things do change, and that happens because strains mutate and new information comes out, and science is a series of trial and error until you learn more about something. And we have to have a willingness to just listen and learn from that, because by working together and having faith in the people who have educated themselves and to become more aware about this and help others, we can truly do better by listening to them.
Yeah, I think she makes a really great point regarding the mask and this idea of normalcy and stuff. And my viewpoint would be that the best chance at normalcy that we really have is to institute the mask. And certainly when we were working at the hospital level with the local school boards and giving advice on our viewpoint of the situation and the situation with the current healthcare crisis, the numbers at the hospital, the not enough beds for everybody that needs one kind of thing. Masking was really felt to be the most important piece to having more of a normalcy to the school year. Unfortunately, people have focused on the mask. I think the masks are really a means to an end. It's the means that we can keep kids in school, we can reduce that quarantine distance for if there is a positive case, the transmission is down. And I think the best evidence that masks work to help keep kids in school is look at last year. Not only were the COVID numbers low, but the numbers of RSV were very low. The flu really just didn't even exist last year. And so if anything, we should be promoting masks in schools, and most of the time as a way of preventing absenteeism, because kids were able to go to school, students, young adults, because the masks were working. And so I would say that's the biggest evidence of the success of masking last year. And if you look this year at the districts that started, particularly in other states, without mask mandates in place, a lot of them had to shut down. And knock on wood, locally we've not seen that situation, because both school districts, both because of the state mandates originally and now through local decisions, have continued to institute masking. So I'm very proud of the local school board decisions personally, and I think that has an impact both keeping kids in school as well as containing the spread in the community.
Yeah, and going off of what you said, the new variants have also made it more difficult even with masking. There's been a very significant amount of more quarantines and positive cases in the schools that I've noticed, at least at Callaway, because of the new variants. So another thing that we could potentially be looking at is more strict masks, like maybe double masking more, or like thicker masks. So that's another thing.
N95s. Yeah.
Yeah, but
No.
I think it's smart that our local school boards have taken it upon themselves to take that extra precaution, because going in without anything, we are risking complete shutdowns of schools, mass quarantines. I've thankfully witnessed in my classroom that when somebody tests positive, I don't really notice, because back when we used to have it, a lot of people would disappear from the classroom. But now, because of masking and social distancing, we're able to effectively reduce that risk. And I think it's smart that we can stay open longer and hopefully reduce our risk by masking and taking care of that while we're in the classroom.
Yeah. And I'll put a plug in here for vaccination, because I think both of the school districts follow that if a student is fully vaccinated, and so that would be the eligible students 12 and over against COVID-19, then they don't fall into a quarantine isolation situation unless they were to test positive. So another big step in keeping kids in school is following through with vaccination. And the Pfizer vaccine is approved now for ages 12 and above. It's a 2-shot series, and so 2 weeks after the second shot, if you were to be exposed at school and you're asymptomatic, you don't have to quarantine. And so that's another big step of progress and the effect of the vaccinations also, in addition to masking. So
Yes.
Excellent. Next question. One thing that has been said by some is that science, of course, changes and progresses. What specifically has changed about our knowledge of this disease?
So I'll start with that one. The first thing would be treatments, and so we have this treatment called monoclonal antibodies, which existed before COVID-19 for other diseases, but the development of several different monoclonal antibodies to treat active infections have made a tremendous impact on hospitalization rates. For every 7 people that you infuse with monoclonal antibodies that are actively infected, you prevent 1 hospitalization based on data out of a health system in the western part of the United States, Intermountain Healthcare. That's one big thing is, treatment, making progress there. Understanding the effect of steroids and some other immune system suppressants on the spread of the disease throughout the body, the effect that it has. COVID really functions almost like a house fire. It comes in, it causes a lot of damage, and you can get rid of the virus, but then you're still left with the damage in the lungs in particular. And so patients that end up with prolonged stays in the hospital on ventilators, having to go on oxygen even after they're discharged from the hospital, having complications of scarring in the lungs, and a lot of what we would call disability or morbidity from the disease. It's really unfortunate to see that. So understanding the long-term effects, 18 months anyway from the first infections here in this country. The treatments have made a little bit of progress, but still not where we really need to be. We don't have a silver bullet just yet, other than vaccination. I would say that's the closest thing we have to a silver bullet. And then just understanding the spread, the effect of masks, such as cloth masks, how effective are they versus a regular mask, an N95, things of that nature. All of that has accumulated over time. And unfortunately, some misinformation's also made it into the mainstream. And I guess we can talk about that a little later. So,
yeah, absolutely. Another question, since the vaccinated and unvaccinated can get and can transmit COVID-19, why should a person be concerned with receiving a vaccination?
So I'll start and give a few numbers on vaccination, just because this is something I spend a lot of my life dealing with in researching and convincing the people that are either unvaccinated or against vaccines of why they should consider getting a COVID vaccination. So the original data out of, for instance, the Moderna trial that was published that gave the original emergency use authorization for using it in a widespread manner, 30,000 people, and 5% of the active cases were in the vaccinated group. 95% of the cases were in the unvaccinated group. There were, all of the severe cases were in the unvaccinated group. The 11 people, I believe, that got it in the vaccinated group were only mild in nature, so to speak. So yes, it's not perfect. Nothing in life is. There's no 100% guarantee. You can do everything right and still have an accident, right? I mean, you wear your seatbelt, you defensively drive, you can still get hit by a drunk driver. Things like that happen. And so I think this idea that a vaccine should be 100% effective, nothing's 100% effective. There's nothing that we have that we can do that's 100% effective or guaranteed. So, vaccinations are 100% proven to reduce your risk of getting infected. And if you're not infected, you're not going to transmit it. They definitely reduce your risk of becoming hospitalized. Right now in our hospital, 5% of our COVID patients are vaccinated. So again, that follows right in line with the original data. So 95% of the people taking up beds in the hospital with prolonged illness, possibly suffering death, are unvaccinated people. So the reduction of risk of hospitalization, severe disease, and death would be the big reasons why you should consider getting vaccinated. Certainly the older you are, the more important it is for your personal safety. But then as you're younger too, a reason to get it would be, again, a reduction in infection rates leading to a reduction in transmission. So if you don't get it, you won't transmit it. And if there's not a lot of people around you to give it to you, your risk of contracting it's lower too. So that would be my plug for vaccines and why they're important, even though they're not perfect. So.
And I've had to have that discussion with some of my classmates. I remember that a couple days ago. One of my classmates was like, well, why did you get the vaccine if it's not foolproof? Well, nothing is foolproof. And if we believe that, then that wouldn't be wise. But just like the flu vaccine, there are different strains. And we still get the flu vaccine in hopes that we get greater protection. And like you said, lower hospitalization rates, lower severity of symptoms, lower chance of death. And I was like, simply the positives outweigh the cons in this situation. And if I can have any protection from COVID-19 and the chance of giving it to someone who it may harm worse, then I'm going to take that chance and do my part and get vaccinated.
And they've also wanted us to get boosters. So my uncle is a state representative, and he got his vaccine immediately because they offered it to the legislator before everyone else. And so he recently got his booster because of the new variants. It's gotten lots of more severe, so they've been suggesting boosters. So I'm curious to see how that's going to affect the amount of cases in the future when people are able to get more boosters.
Yeah. And I would say, the biggest thing right now that's driving our caseloads, again, would be the completely unvaccinated. Again, the unvaccinated or partially vaccinated patients are the biggest bulk of our patients that we're seeing right now, particularly in the hospital. I'm unaware of any fully vaccinated patients in this county passing away. We've had pretty good number of deaths, unfortunately, and I don't believe any of those patients were fully vaccinated. And in our hospital, we do track that. And besides death, look at how long you have to stay in the hospital. If you're unvaccinated, right now we're showing on average you're going to stay in the hospital twice as long as a vaccinated patient.
Recently, my other uncle was set on a ventilator. He's at home well now, so that's good. But he was not vaccinated, so
yeah, it's hard. And vaccines have become such a hot button issue, and I would say one of the big problems around vaccination right now is that there's actually a very small, very vocal minority of healthcare workers that are actually probably the biggest spreaders of misinformation. And unfortunately, if you work in healthcare, you have clout with somebody, you have influence over certain people. And so one of the biggest problems that we're battling right now concerning vaccines is the misinformation and the bad advice that certain healthcare workers are giving out, whether they be nurses, nurse practitioners, physicians, certified nursing assistants. If you work at a hospital or in a clinic, somebody's probably going to look to you for advice. And if you tell them, the vaccine has a microchip or it's gene therapy or any number of other kind of crazy ideas, things that we've heard, those people are going to listen to that, and somebody's going to die because they heard this misinformation. I mean, it's really unfortunate and it's very serious. And at the same time that we're in this situation, so. Again, I'm very encouraged to hear these pro-vaccine stances here tonight from our high school students, because that's certainly the experience that I have, at this time.
And you can see that not only are healthcare workers the minority helping boost some of that misinformation, social media has made it a large problem. I utilize social media on a daily, and I have to mute certain people and unfollow certain content because there's information that is being shared that is creating fear out of something that is supposed to be deriving hope.
Yeah, a couple months ago, actually, there was a person in my feed that posted that as soon as they released a mandate to where you don't have to wear masks, that the number of cases was reduced, which is quite hilarious, I thought, considering that now vaccinations are being passed out, and so it was really being reduced because of the vaccinations, not because we were not wearing masks anymore.
Well, and what types of things are we hearing out there in the community? The mistruths that are being spread. I've heard things about a microchip, and it's almost, well, it should not be humorous at all, because we're not talking about politics. We're not talking about just some kind of issue to set aside. This is life and death. And this is our neighbor, this is our family member, and we should be a little bit more careful with the information that we should be responsible with. Continuing on, next question. How has the rise in the number of those testing positive impacted our healthcare system and our schools? So Dr. Odell, we'll start with you.
Yeah, so on the healthcare side, it's had several impacts. One would be on the overwhelming number of patients. And again, once a patient's sick enough to be in the hospital, the treatments are actually quite limited on what you can do. And so you're very much relying on that patient's body to somewhat heal itself with some supportive care. And it obviously doesn't always work out, as Sam was just telling us, his person that he knows that passed away. So, unfortunately, it takes up beds, and then, there's a finite number of resources when it comes to healthcare. We do a really great job in this country trying to take care of everybody, but at the end of the day, it is finite. And so the problem becomes, number one, if you have COVID and you need care and there's not a bed available, that's a problem. If you don't have COVID, let's say you have a heart attack, you have a ruptured appendix, you've had a stroke, you've had a car accident, and you need health care, if the hospital's full, the emergency room is full, that's a problem. If you're in our area and we don't have all of the subspecialists available that your larger university centers or bigger cities have, and we typically would transfer through a helicopter or airplane, something like that, a patient to another hospital, suddenly those hospitals are full too and they won't accept the transfers. And we've seen that locally. Calling 30 hospitals over the course of 30 hours to try to transfer a patient that needs a service you don't offer, while the patient continues to worsen in your care because you can't offer a treatment to them, that's very hard, and it's hard on the spirit too. And so the other side of it, rather than just the raw number of people that we've had to take care of, would be the burnout, I think would be the most appropriate term that a lot of the people in healthcare are feeling right now. Last year when this first started, there was a lot of healthcare hero talk, and there was a lot of support from the community. Fast forward 18 months later, and a lot of that has changed. It's changed, is what I'll say. I'll leave it at that. And unfortunately, there's a sense that certain people won't take steps to help themselves, i.e. through vaccination and following masking rules and things of that nature. And then they end up in the hospital, and then they have a poor outcome, and somehow that falls back on the hospital or the healthcare workers as their fault. And it's a little bit disheartening to go through that. And when you deal with that on a daily basis, it wears people out. And people begin to exit the workforce, and then suddenly you don't have enough nurses to staff the units. You don't have enough physicians to take care of the patients because people just psychologically cannot do it anymore. I would equate it to war experiences where it wears you down and you eventually just sort of lose the ability to keep going. So those are some of the things, and there's more, but I'll leave it at that for now and let them chime in on the school experience maybe.
It's sad, one, to see that our hospitals are being so overwhelmed, and all of the effort that you all are putting in to help handle all of these cases and to try to help people who need health care in other forms besides COVID-19. But I've also seen it a lot in my school that our school districts are overwhelmed with the responsibility of not only maintaining education, but handling a health crisis at the same time.
Yeah.
My teachers are working double duty. They're having to teach in person in class, but also keep a connection with their students online and provide virtual services, which several teachers are not used to. Our faculty and administrators and nurses are having to keep track of who's vaccinated, who's unvaccinated, who to quarantine, how close were they at lunch. It's a responsibility they didn't have to have. And just simply masking and following guidelines and getting vaccinated can make that just a little bit easier. And as a student, it's overwhelming for my mental health to sit in a classroom and wonder, is someone next to me positive? Am I going to give COVID-19 to someone if I potentially contract it? And it's just unnecessary stress, and potentially stress that we can reduce by every little thing that we do with masking and social distancing and vaccines.
The other thing is there's also kids who their parents won't let them get the vaccine, or they do not want to get the vaccine, and then they're quarantined, and then their teachers can't reach out to them because they're too busy with in-person students. My friends, for example, he was quarantined for 2 weeks, and he was behind on all of his work because he couldn't reach out to his teachers. And one of my friends wasn't quarantined, but he was out for a couple of days, and he couldn't get a hold of his teacher to catch up on his assignments, and he was behind too. It not only does it impact the teachers, but also impacts the students on their education level that they were receiving while being online.
Mm-hmm.
And the other part of that too is with students in classes, at least they are getting that interaction with the teacher in person and with their classmates. But then again, also the pandemic affects you outside the classroom too, that normalcy that students look for, participating in sports, extracurricular activities like band and whatnot. And so I see how that would, it's so much a part of your life. And I hope that for your sake that we get back to that new normal soon, because you need to enjoy it. This is your time. Dr. Odell, time is beginning to wind down. I had a true or false question for you. Are you ready?
Sure.
Okay, it's a statement. If you've had COVID, then you do not need to get the vaccine. True or false?
So I would say that's false. While yes, having prior infection with COVID does offer some natural immunity, as people will call it, the best way going forward to continue to protect yourself, because again, the science, the knowledge base is continuing to evolve on how long the immunity lasts, what's the level of protection. If you have had an infection, around the 90-day mark after that, it is advisable to get the vaccine. Certainly if you've not been infected, you definitely need the vaccine. If you need it now, you need it yesterday, really. But if you've had the infection, if you've had COVID-19 documented, 90 days down the line, you should consider getting vaccinated to continue that protection, to boost your level of immunity. Personally, I've had COVID-19. I contracted it last December, and got through it just fine. And the first thing I did when I was able to get the vaccine was to get it. And when I got the second shot, I went and got that. And when I was able to get the booster shot as a healthcare worker, I got that. And so, again, I talk the talk and walk the walk, if you will, on the vaccination. My family members in my household that are eligible are fully vaccinated. I do have one son who's too young to be vaccinated yet, but I'm anxiously waiting that FDA approval for the Pfizer vaccine to be approved for the 5 to 11-year-old group, and then he'll be there the first day to get it. So I think it's incumbent on everybody to do everything they can to reduce their risk of infection as well as the risk of spreading it to others. And vaccination is really the most important step you can take in that fight against COVID-19, protecting yourself, protecting your family members, protecting those members of the community that might be vaccinated that are immunocompromised. Maybe they haven't had a great response to the vaccine. They're less than fully covered. It's a small ask to receive a vaccine that's been proven to be effective and safe over the past 9 months or so that it's been available widely. So,
yeah, it's also interesting how people refuse to get the COVID vaccine while they get other vaccines like tetanus shot or HPV. Like, it's interesting how they don't question those vaccines. Why go straight for COVID when you could say that the HPV vaccine isn't effective, or the tetanus shot isn't effective, or even the flu vaccine, which is sometimes talked about, but not as much. Yeah. So that's also an interesting point.
Yeah, that's very hard. And sometimes that's one of the tactics that we use when we're discussing vaccines with people who are maybe hesitant with receiving the COVID vaccine, is explaining the evolution of vaccine technology going from the measles and mumps and rubella vaccine, MMR, and understanding how that works, and then showing them, well, this is how the COVID-19 vaccine works, and you can actually see it's very similar. It's just a little bit more of a cleaner process, if you will. So there is a small subsegment of the population that is anti all vaccines, and that's a very difficult audience to reach, particularly on this one. But for the folks who are hesitant, oftentimes they just haven't received enough education on the safety, the effectiveness of the vaccine, and they just needed somebody to kind of walk through it with them. And so that's the group of people that I think we as healthcare workers try to focus on in order to reach that. We're never going to get 100% vaccination in this country. Even with childhood vaccines, I think there's something in the mid 90% range of penetration in childhood vaccines. So you're never going to get to 100%, but if we could get above where we are now, which is around 50% of folks in our local county, it would be great. If we could get closer to 80 or 90, particularly as kids are able to get vaccinated, that would do a lot to help sort of stem this tide that we're up against. So I'd love to spend 45 more minutes talking about the COVID vaccine and why it works and how it works and why you can trust it, but maybe we'll save that for another day.
And along those lines, final closing thought. People want some kind of a remedy. They want some kind of a magic in a bottle to be able to move forward. And we want to get back to that new normal. What advice would you give to your friends, your family, as far as how do we get back to that new normal and how do we move forward? What kind of magic would you share? What's your advice?
Sam, why don't you go first?
Well, I mean, it's going to be a while before we get back to normal, I feel, because this is something that I feel we'll talk about for a very long time in the future. I mean, just stay safe, get vaccinated, and follow guidelines. We'll get back to normal sooner. I mean, it's really that simple. It's just people have to follow those rules.
Caroline?
I would just say, well, ironically, together. We have to do this together because it's not a solo mission, and we need everyone in order to be able to effectively battle this. And also just do your part. Educate yourself, get the vaccine, mask, take care when you're around someone who potentially can't get vaccinated because of certain reasons, and just be kind. In a time when we're very apathetic and we're very full of hatred in this very political time, be kind, because everyone's hurting in a different way.
Dr. Odell?
Yeah, I think that's great. So from my standpoint, I would say the most important factor in the fight against COVID-19 is the vaccine. It's safe, it's effective. Again, the people in my household are vaccinated that are eligible for it. And so, again, it's something I believe very strongly in. The biggest risk factor for dying of COVID-19 is being unvaccinated. The biggest risk factor for being hospitalized is being unvaccinated. So the vaccine plays an extremely large role in us continuing to get back to whatever our new normal is going to be. Several hundred years ago, it was unheard of to wash your hands before doing surgery as a physician. And, the first cars that were produced didn't have seat belts. And so over time, we learn, different things that we can do in order to help the population move forward and reduce all of those risk factors to our life that cause preventable deaths. At this time in this country, my feeling is that the biggest source of preventable death is COVID-19, and the prevention there is the vaccine. So I would encourage anybody watching, please go out and get vaccinated. If you have more questions, reach out to your healthcare provider. And if you feel like what you're being told isn't true, then ask around, ask somebody else. Like I said, there are some people out there that are spreading misinformation, unfortunately, and so we at the hospital are here to help you walk through that decision if that's what it comes down to, and you just need a little bit more information. So anyway, again, go get vaccinated. They're safe, they're effective, and it will be your biggest protector from ending up dying of this disease, or somebody in your family catching it from you and dying of it. So.
I'd like to thank once again our distinguished guests for joining us. Thank you, Dr. Odell, Caroline, Sam. I know that you all have very busy schedules, but these discussions are important, and it's good to hear different perspectives and to be tolerant and, like they said, kind, because we are better when we're together. Thank you again.
94, 121, 641. Hazel, Lynn Grove, Kirksey, Almo, New Concord, Faxon, Callaway, Murray. We are Lakers, we are Tigers, we are Racers. We are better together.